So, good afternoon, learners. Hope you are all doing great today. How are you doing? You are welcome to NSG 304 class, and my name is Farinu Hemhe. So, today our topic is going to be placenta previa. We are treating placenta previa today. So, what are the outline for the course? The things you're expected to know, you're supposed to know, we are going to talk about the introduction, We're going to talk about the definition of placenta previa. We're going to talk about the prevalence, what are the causes, or let me say, what are the things that can predispose the patient to placenta previa, what are the signs and symptoms, the things you are going to know, the visible signs that you are going to see, and it will actually make you to recognize or know that, oh, this patient is having placenta previa. And how do you diagnose placenta previa? You have to know that too. We'll talk about that. What are the types? We have different types of placenta previa. We want to talk about the nursing management. How do you manage it? The medical management and the aftermath, the effects, the complications of placenta previa. So what will happen if it's not being properly treated or is being mismanaged? So we are going to talk about that too. And the expected outcome. What are the expected outcomes? As learners, you're supposed to know the definition of placenta previa. You're supposed to be able to define placenta previa. Identify things that can predispose a patient to developing this condition. You have to know the symptoms, or let me say the signs, and you have to be able to know how to diagnose it. Then know different types and the differences between each type of this condition. Then know the medical management. Students are supposed to know how to manage the condition as nurses. So we'll explain in details the nursing management and the complications of this particular disease condition. I hope you are clear. Now, let me just talk briefly about placenta previa. Normally, we know that placenta is usually located in the upper uterine segment, and anything aside that will be referred to as an abnormality. So placenta is supposed to be located in the upper uterine segment, although in the early pregnancy, placenta might be located in the lower uterine segment, which is not a cause for concern at all during the early pregnancy days. But we know that with time, this placenta is supposed to find its way back to the upper uterine segment gradually. So, but the persistence of placenta in the lower uterine segment, when placenta remains in the lower uterine segment beyond the normal time, then you know that, oh, it is likely that this is a case of placenta previa. So placenta is not supposed to be located in the lower uterine segment for any reason after some time, especially beyond early pregnancy. I hope you are clear. So now let's go to the definition. How do we define placenta previa? You don't need to cram it, it's very simple. Just know that placenta, abnormal situation of placenta in the lower uterine segment. It is wrongly situated. I've said it in the introduction that placenta is supposed to be located in the upper uterine segment. Now, in placenta previa, placenta is abnormally situated in the lower uterine segment, near the cervix, around the cervix and near the cervix. So it is very simple. Just understand basically that this placenta, the normal placenta is located in the upper uterine segment, but now in placenta previa, it is located in the lower uterine segment. Now, how common is this prevalence? That how often do we see these cases of placenta previa? That's just the prevalence. And like I said, you can see from your slide, 1 in 200 pregnancies. And what does that mean? That means if it's out of every 200 pregnant women, if there are 200 pregnant women, at least we'll see one. There will be one of these pregnant women that we have placenta previa. So that's very straightforward. What are the causes? Or let me say things that might predispose patients to developing placenta previa. Well, like we said, the cause is unknown. That is the meaning of the cause is idiopathic. That means it is unknown. No one can actually say, this is what causes placenta previa. But there are some things that we are emphasizing that, oh, it might probably make a patient to have it, although we are not sure. So, and the first one is age. like if you are 35 years and above, that's like an elderly primate, there is possibility that um, your placenta might be located in the lower uterine segment. Another thing is, maybe before, during past pregnancies, the patient has developed placenta previa. So there is still likelihood or higher chance that this patient is going to have it in another pregnancy. What about multiple pregnancy, like in the case of twins or triplets? So that is another condition. If a patient has done surgery before, maybe you have involved in, you have done a particular surgery before, like a myomectomy, cesarean section, if there is a scar, so the placenta will not want to locate itself, because one thing about placenta is that during first pregnancy, the placenta is situated in a particular place. The next pregnancy, the placenta will not want to stay, will not want to embed in that particular that particular part, but that's like the endometrium. So it prefers to change locations. So in case of multiple pregnancy now, the placenta, or let me say like maybe there is a scar in a particular part of the endometrium, the placenta will not want to locate itself in that particular area. So it will definitely find another place to locate itself. What about the use of cocaine and smoking? That's another predisposing factor. Then even being pregnant before, like I said, or you've already had a baby, can predispose you to having placenta previa. Dilatation and curettage procedures can also expose the patient to having placenta previa. So now, how do we know the symptoms of placenta previa? To make it very easy, I've actually developed an acronym which is previa, from the word previa, so that will make it easy for the learners. What are the things that you see that will make you to know that, this patient is definitely having placenta previa? The first important thing you are supposed to know is painless bright red vaginal bleeding. That's number one. Painless bright red vaginal bleeding. We see that there will be bright red because it's an oxygenated blood, so there will be painless bright red vaginal bleeding. It's usually very painless. Patient does not feel any pain because there is no detachment or anything that is making, or there is no abdominal, there's no contraction, nothing that is making the patient to feel discomfort. Another thing is that the uterus is usually very relaxed. There is no contraction. The uterus is soft. It is not tender, so it is always relaxed. It is soft. So once you probably see a patient, the uterus is relaxed, there is bright red vaginal bleeding, the uterus is relaxed, it is non-tender, it's soft, then you know that, definitely there's probably that this patient will be having placenta previa. There might be episode of bleeding, there might be visible bleeding that you can see from the vagina. If such a patient engages in sexual intercourse, because the placenta is located in the lower uterine segment, then definitely there is possibility that this patient will be bleeding after intercourse. Abnormal presentation is also signs and symptoms. So what are the abnormal presentation? Like in the case of breach now, yes, breach is an abnormal presentation. So it can cause placenta previa can bring about abnormal presentation. Instead of presenting with head, a baby can present with breach in placenta previa, because the placenta is already situated in an abnormal situation, in an abnormal space, which will affect the baby from presenting with head. Then I want you to note that in a placenta previa, the fetal heart rate of a child, of a baby, is usually normal. It is not affected because the placenta has not been detached. The placenta is just situated normally, not that anything is wrong with it. Once you don't tamper with that placenta, since the placenta is bringing oxygen to the baby and the placenta has not been tampered with, the fetal heart rate will be normal, so nothing will be wrong. So if you listen to such a fetal heart rate of a patient, it will be normal. And so I want you to know that the most important thing in this placenta previa is bleeding, bright red bleeding. Is there any question? Okay. So let's go to the next slide. Now, types How do we diagnose placenta previa? Sorry. How do we diagnose placenta previa? So how do we diagnose placenta previa? It's very simple. All you need to do is just to um, tell the woman to do ultrasound. Ultrasound will help us to know the exact location of placenta previa. So just order for ultrasound, and from the signs and symptoms we have discussed in the previous slide, you should know that those signs and symptoms will also help us to diagnose placenta previa. Now, what are the types of placenta previa? We have 3 types of placenta previa. Before, we used to refer to it as type 1, type 2, type 3, but now it is called partial, marginal, and complete. What is partial? Partial is just that, like you said earlier, placenta previa is location of placenta in the lower uterine segment. But there are different types. There are grades of this particular disease condition. It might be partial, it might be marginal, and it might be complete. Partial is just that placenta is located in the uterine segment, but it is not covering the cervix. It is just located very close to the cervix. Maybe the tissue is just extending close to the cervix. So in that type 1 now, it is very easy to manage. In fact, the patient might deliver vaginally without any problem, because the placenta is not impeding the way of the cervix. It's not covering the cervix, so we might not tamper with it. So the patient, it's possible that patient, it's very, very possible that this patient can deliver vaginally. The marginal one, the placenta is over the cervix, but it did not cover, it's not covering it. It is not covering it. Why the complete one is the placenta is covering the entire cervix. It is covering, it is centrally located, it's covering the entire cervical horse. So there is no way the baby can come out. So in this type of placenta previa, you have to prepare your patient for cesarean section. You should not try to allow your patient to go through normal labor, because it is very detrimental to the health of the mother. It can lead to complications a lot, bleeding, and even intrauterine fetal death. So you should not try to prepare such a patient for normal delivery. Now let's go to the medical management. What are the things we're expected to know here? How do we manage a patient with placenta previa medically? Just order for laboratory investigation, because we know that there is high risk that this patient is going to bleed. So we want to know your patient blood group, we want to know cross match, because the patient at the end of the day might lose a lot of blood and they will be need for transfusion. So you want to know the full blood count of the patient, check the PCV of the patient. We want to know the rhesus factor of this particular patient. Is the mother rhesus negative or rhesus positive, so that we can prepare ahead. Maybe the patient is going to need ROGAM injection. These are the things that we do. We have to prepare. Patients will be resuscitated with intravenous infusion. What about blood transfusion? In case the patient loses a large amount of blood, definitely this patient has to be transfused, because we don't want to lose the patients. Then tocolytics that helps to slow down contraction, or that helps to inhibit labor. We put such a patient on tocolytics because we don't want the patient to go into labor. We want to prepare the patient for cesarean section. Another thing we give is corticosteroids. And what is it meant for? This corticosteroid is to help for lung maturation. We all know that most of these babies, their lung is not well, the surfactant in the lungs has not yet developed enough. So we want to put the patient on corticosteroid to help in lung maturation. Then finally, prepare your patient for cesarean section, whereby we talk about preoperative management of such a patient. Then lastly is the nursing management. Nursing management. What are we supposed to do? First thing is to admit our patients for bed rest. Yes, we don't want to limit any activity. We don't want our patient to, we don't want to conserve the energy of such a patient as much as possible. What's the question?
Is it not more than 10 minutes?
Yes.
How many minutes?
Wow, 14 minutes.
That's too much.